Thank you. That was a lot of great information, and I'm really grateful that we don't have some of those restrictions. But what kind of barriers exist to accessing care? Can you talk a little bit about that?
Yeah, sure. So even though we do have really great access here in Maryland, unfortunately, that doesn't mean that there aren't barriers that do pop up for folks. So I'm going to go into more detail in another slide about the financial barriers that people have to deal with. But financial barriers are the most common barrier that people face. It's often very difficult to get insurance to pay for abortion care, whether you have public or private insurance. And so abortion care can be a cost that's really out of reach for people. And then it can cause people to have to put off a procedure because they're having to fundraise for the cost of their care by asking friends and family to borrow money, by working with local organizations to raise that money. And it can cause folks to have to keep putting off their care. And unfortunately, this can create a cycle because starting at about 14 weeks gestation, the cost tends to rise week by week. And so once you get to that point, if you're continuing to fundraise, you might find that you've fundraised enough for the prior week, but then you go in and you don't have enough for that week. And so it can really get folks caught up in this cycle where they're fundraising, but they're never quite there. And it's delaying their care to a point that it gets really challenging. Another really common barrier that folks face is around logistics. So if somebody is having general anesthesia or twilight sedation, which are two options that are offered for folks who are having in-clinic procedures, they have to have a person who can drive them to and from the clinic and stay there. And that can be a really tough thing for folks because they have to ask someone in their life to take them to the clinic. And that means you have to disclose to someone that you are seeking abortion care. Maybe you don't have anyone in your life who has a car. Maybe you don't feel comfortable telling anyone in your life that this is something that's going on for you. So that can be a barrier for folks. If they have kids, they have to find somebody who can watch their kids while they're at their appointment. If you have more that have a multi-day appointment, which is something that happens for folks starting around 18 weeks gestation, you have to find someone who can watch your kids for potentially 2 to 3 days. And that can be a big expense for folks who are already potentially, used to watching their kids every day and may be unemployed. And then thinking about folks who are working an hourly job and don't have a regular schedule. If they're scheduling an appointment, they have to ask off of work for that appointment. And so they're losing out on wages for that job. So there's a lot of costs involved with accessing care that are not necessarily even the procedure itself. All of these logistics that are involved that can really prevent someone from being able to access the care that they need, because trying to figure out how to deal with all of those logistics can really cause a delay enough that somebody is not able to access care. So there was a study that was done a few years back to look at what are all of these additional costs that are associated with these logistical barriers and all these logistical issues that come along with care. And the study found that people paid an average of $44 in transportation costs to their appointment. For people who lost wages as a result of their appointment, they lost an average of $198. And that people who had to pay for childcare paid an average of $57. So that's a lot of additional money that folks are potentially having to pay and fundraise for on top of the cost of the procedure. And those are all of these other logistical pieces that people have to figure out that can cause people to delay their care or cause people to not be able to seek care, even if they figured out that financial barrier in the first place. Another reason that I hear fairly often for folks being able to access care is people not knowing that they were pregnant until later in pregnancy. So studies have found that about 1 in 13 people didn't know they were pregnant until about 13 weeks or later. So once they're already in the second trimester of their pregnancy. And 1 in 475 didn't know that they were pregnant until 20 weeks or later, which at that point, accessing care can be really challenging in many states, and even in Maryland can be relatively challenging. So some people just don't know that they're pregnant until accessing care is already a very expensive process and potentially a much more challenging process logistically, because it can be a multi-day procedure. It can require you to figure out transportation for yourself. And so That can cause a lot of barriers for someone if they don't find out that they're pregnant until later on in their pregnancy. Another issue that can pop up is crisis pregnancy centers. So crisis pregnancy centers are facilities that present themselves as being women's healthcare facilities. They offer free services such as free pregnancy tests, sometimes free ultrasounds, free baby supplies, free parenting classes. Their real purpose is to talk folks out of having an abortion. So what they do is they offer a free pregnancy test. You come in, you take your free pregnancy test, then they bring you in for counseling. And in that counseling, they give you inaccurate information about potential risks of abortion care. So for example, they'll say things like 1 in 3 people who has an abortion will attempt suicide, which is not factually true. Studies have shown that people who have abortion care are not more likely to have mental health issues than anyone who has not had abortion care. Or they'll say things like, everyone I know who's had an abortion later had a breast cancer scare. Again, not true. There's no evidence for a link between breast cancer and abortion care. This has been shown through many studies and is backed up by a lot of medical associations. But they'll give you really misleading information about the risks involved with abortion care to try and talk you out of accessing abortion. And if you're someone who doesn't have the information that you need to make a decision about your own body, of course that's going to cause a barrier for you. That's going to make you afraid and make you maybe rethink your decision. And so we do see folks who wound up at a crisis pregnancy center and that delayed their care for a long time or potentially made them kind of rethink their decision, even if they felt very firm in their decision beforehand. So not having the information that you need or being given incorrect information can absolutely be a barrier for people. And then finally, abortion stigma is a huge issue. So we live in a society where talking about abortion is just something that's not seen as socially acceptable, which is a real shame because we know that 1 in 4 people with uteruses will access abortion care at some point in their life. So there's a whole lot of people around you who have probably had an abortion at some point in their life. And it's not something that we should be treating as this rare, very scary occurrence, because it's actually a fairly common medical procedure that is very safe and that many people access. But as a result of people talking about it in this way that makes it sound like it's this very scary, not okay thing, people may struggle with knowing who it's okay to talk to about this decision and not feeling like they know who it's safe to go to discuss it with, feeling like if they tell people they're going to get judged, not knowing who they can ask to, for example, drive them to the clinic if they're somebody who wants to get general anesthesia or sedation and they need someone to come with them. And all of that weight on someone while they're trying to make their decision and while they're trying to access care can really be an additional barrier. And this is something I hear from folks all the time, that feeling like they can't talk to their loved ones about what they're going through really adds a whole layer of challenge for them in accessing care. And then one study found that about 27% of people had to tell someone in their life that they did not want to tell that they were going to get an abortion because they needed someone to go with them. They needed somebody to give them a ride. So we know that this is a really common issue, and it's likely that it's causing folks to delay care because they're trying to figure out what to do. So abortion stigma is a huge issue. It's something we're always working on. And I encourage you to have conversations about this with your loved ones and to start thinking about it, start talking about it more openly, because it's something we really need to work on.